Phytotherapy options for long COVID. Herbal medicine reduces the inflammatory drivers of pulmonary pain and discomfort in long COVID presentations. For background, long COVID is defined by the WHO as a post-acute COVID syndrome that lasts longer than 12 weeks, and it affects between 10 and 30% of community-managed COVID-19 cases, with 76% of patients hospitalised with acute COVID. So the key there is to stay out of hospital, and the way to do that is to keep your vitamin D levels above 80 nanomoles per litre. It seems to be, across all the studies I've read, the most predictive of hospitalisation is very low vitamin D, more predictive than polypharmacy or metabolic conditions or obesity. The most common symptoms of long COVID are fatigue, palpitations, breathlessness, chest pain, chest pressure, headache, and joint pain, and 67% presented with pain in the ribcage, and 95% showed a dysfunctional breathing pattern when sitting and standing. So in my patients, they're presenting with fatigue that doesn't resolve after COVID, sometimes heart palpitations. The breathlessness has been diagnosed as asthma a number of times, and the chest pain and chest pressure seems to be coming from that post-COVID cough, giving inflammation and pain into the interstitial muscles, the muscles between the rib cage, which means there's pain with breathing and laughing and coughing. So SARS-CoV-2 is a respiratory virus with a relatively unique spike protein, and that enters the human epithelial cells here via the ACE2 receptors. And we have a lot of ACE2 receptors in the human lung. So in an ordinary immune response, there would be a nice mucosal membrane layer here, part of your innate immunity, and that can be compromised with low vitamin A levels, low essential fatty acid levels as well. So they're essential nutrients here to think about. Now, in a normal COVID situation, these adaptive immunity cells, the macrophages, the neutrophils, would come in and shut down the virus. When we're seeing long COVID, these cells are secreting cytokines, which are in and of themselves inflammatory, and they come back and shut down the adaptive immune response and feed back into making more of themselves. So with COVID, it's tumor necrosis factor alpha, the interleukins 1 beta, 6, 8, and 17 predominantly. These cytokines then flood down into the blood vessels. If the spike proteins themselves lodge into the epithelial cells here, we have extra trouble because the veins themselves start becoming distorted and bulgy. As the cytokines come down, they are then activating anywhere they touch in the rest of the body via the bloodstream. So possible treatment goals here are to resolve any ongoing viral infection, to reduce inflammatory cytokine levels, to modulate the immune response, to protect the epithelial and endothelial cells, to reduce symptoms and improve patient comfort levels in general. So inflammatory cytokines to look out for are the interleukins and the tumor necrosis factor that we have already discussed, as well as interferon, beta, gamma, and lambda, which go higher in viral infections anyway. So pathology to think about if you needed to run some blood tests to confirm your suspicions. SARS-CoV-2 antibodies would be present, as well as ferritin, C-reactive protein, ESR, and fibrinogen levels, which are usually elevated. Lymphocyte subsets would get low natural killer cells, low CD4 and CD8 plus cells. In a full blood count, we're seeing decreased lymphocytes. Leukocytes are either elevated or very low, so leukocytes can go either way. In a cytokine panel, we're expecting high inflammatory cytokines, and in liver enzymes, elevated ALT and AST with vitamin D as a baseline. It must be higher than 50 nanomoles, but preferably 80. So herbs that are useful are Isatis indigotica, which is Brassicaceae family. It's an antiviral immunomodulatory herb with anti-inflammatory actions and a lung affinity. And it's indirubin and the urucic acid that are useful here. So Isatis is not a herb that moves at the speed of science. Isatis has been in human medicinal use since the Iron Age. The U research experimental evidence indicates that indirubin is associated with antiviral activity against the original SARS coronaviruses and influenza A. And it's also assisted in restoring leukopenia, so that's low leukocytes after whole mice irradiation with significant serum reduction levels of tumor necrosis factor alpha, interleukin 1 beta, and interleukin 6, which are key players in our SARS-CoV-2 patient. So urucic acid is also broadly antiviral, inhibits inflammatory mediators such as the interferons because it inactivates nuclear factor kappa B. It also decreases the viral lung load and viral antigen expression and reduces pro-apoptotic signaling, which is the cell death of virally infected cells. And as they die, they explode, and the cells next door then react and stimulate apoptosis as well, because they're in the presence of something they consider to be dangerous. Hyperactivity of multiple signaling pathways and exacerbated immune inflammation in the lung is downregulated as well, which results in lower lung injury and mortality in the mice study. Alchornia cordifolia. Alchornia is one of the most used anti-asthmatic herbs in Central and West Africa. It's a Euphorbiaceae family, with the relevant actions being immunomodulatory, anti-inflammatory, antioxidant, hemoprotective, and anti-asthmatic. It's predominantly the polysaccharides and the phenolic acids and alkaloids that are useful. So the polysaccharide fraction from Alchornia demonstrate an immunomodulatory effect through the activation of monocytes and macrophages, and that modulates nitric oxide levels and cytokine production. It's that activation of cytokines and nitric oxide levels that tank your glutathione and your NAC production, thereby enhancing resistance to infection, which happens when you increase the macrophages. So polysaccharide components from the mouse study show that they downregulate the expression of the cytokines that we're particularly interested in SARS-CoV-2. Polygonum cuspidatum, Japanese knotweed. It's a Polygoniaceae and it's Huzang. Actions are antiviral, immunomodulatory, anti-inflammatory, antioxidant, neuroprotective, analgesic, cardioprotective, and antithrombotic. And it's the anthraquinones, the amodin, and the flavonoids that are particularly useful here. So amodin is a potent antiviral activity against COVID-2. And it inhibits the viral entry into host cells by binding with the spike proteins and interfering with the protease activity. It's a powerful inhibitor of the tumor necrosis factor alpha and interleukin-1 beta induced nuclear factor kappa B. Excuse me while I shut that door, it was banging slightly. Resveratrol has been safe in most clinical studies that I've read, really, and it's very well tolerated clinically. It's Japanese knotweed is a pharmacy in a bottle. There's not a lot that this herb doesn't do. So this increases the number of the circulating T cells and Treg cells, so they're part of the adaptive immunity. They're a very important part that gets depleted by the cytokine cascade, and the SARS-CoV-2 infection itself does downregulate some of these T cells. It did decrease the pro-inflammatory cytokine levels, but what it did better was increase the antioxidant activity to offset the harm that's coming from the SARS-CoV-2 infection. So what we're thinking for a long COVID treatment overview, there's a sample herbal formula here with Isatis and Alchornia and Japanese knotweed. We could go with curcuma, grindelia, and elderberry. I often use kawakawa or bidens instead of the grindelia though. Nutraceutical adjuncts. When looking at vitamin C, therapeutic ranges in the studies were between 500 and 1,000 milligrams twice a day, but really you could be taking 2,000 milligrams every 2 hours in an acute situation if you needed to. But for long COVID, this 1,000 milligram twice a day is probably sufficient. Anti-inflammatory, it's an antioxidant. It shifts that Th2 response back to Th1, so that's moving away from the asthmatic, psoriasis, inflammatory processes of a Th2 dominant immune system and back into find and protect of the Th1 dominance. It helps to have the host to clear infections and it protects against damage associated molecular patterns or DAMPs. Quercetin, 250 milligrams twice a day, or something with other mixed bioflavonoids, so rutin is good as well. Broad spectrum anti-inflammatory properties, and it suppresses inflammasomes, which are inflammation receptors in the body. Vitamin D, dosed according to the pathology result, but it modulates the innate and adaptive immune responses. Vitamin zinc, a little bit higher than your recommended daily allowance, so 30 to 40 milligrams here. It preserves the respiratory epithelium and prevents pathogen entry for a balanced function of the immune system, and it's antiviral. Fish oil is particularly good and don't overlook it. It's 2,000 milligrams daily, anti-inflammatory mediators and resolvins. It downregulates that nuclear factor kappa B, and it's antiviral. The omega-3 fatty acids also weaken the antiviral response of the CD8 T cells, and therefore they're modulating the cytokines to viral invaders. I would also add to this list, for anybody listening at home, NAC or glutathione as well is very useful, and possibly PEA as well if there's pain. All of those are together The C, the quercetin, the D, the zinc, the fish oil, the NAC, and the PEA are in my Protect powder. And I also do a herbal formula for COVID with some medicinal mushrooms in it as well. But this cough formula is particularly good too if anybody needs that. You can order them on my website. So just a refresh here with the treatment goals. We're just wanting to have antiviral, anti-inflammatory, immune modulating actions, something to protect the epithelial cells, and things to improve your comfort levels as a patient. And some options there, both in herbal medicine and nutritional medicine. So if you've got any questions, do send them through either via email or wherever I do end up posting this. I probably will put it on some social media as well. Pop it in the comments there. References are here too if you need them. Thanks, guys.